Today is the start of Suicide Prevention Month. Suicide rates in the country were a major concern before COVID-19, of course.
That concern was only intensified since the pandemic started. Joining us now to talk about is Linda Lewaniak, Regional Clinical Director at Insight Behavioral Health. Thank you so much for joining us. What can someone do if they think that if they want to commit suicide, especially during this pandemic? What can someone do right away?
Right away, first of all, thank you for having me on. This is a very important topic. If someone is considering it, don't be afraid to tell people about how you feel. Reach out, call someone, talk to your doctor. There's a Suicide National Prevention Hotline. That number is 1-800-273-8255 or dial 911. Reaching out for help from close, trusted members of your community also can be helpful, right out of the box, to help people to help them feel more connected and socially connected to people.
Linda, obviously sometimes there are warning signs. Someone becomes depressed, is not engaging with friends or coworkers, loved ones, but sometimes that's not the case. So how do you spot that when people are they're really good at hiding these signs sometimes?
Sometimes people are really good at hiding because they're not used to talking. And with COVID in particular, because of the social restrictions and the distancing and then the social unrest, people are not talking to other people, so they're not out. So what's really important to do is, if you think someone is suicidal or has increase in mental health issues like depression and anxiety, reach out to them, talk to them, try to get them to stick to their regular routines. Look at their mood swings, ask them how they're sleeping or eating. Has that changed? Do they feel trapped and hopeless? I know that people feel so socially isolated and can't connect. They can't go on vacations and do things that would help them normally. So when they start to hide it, it's really starting to ask the question, particularly people who have had prior mental health issues.
But because of COVID, that's not always easy to do, as you say. And what is it about COVID that may make people, closer to suicide than before?
It's really fears about their own health, the social isolation, the economic stressors, the insecurities about getting adequate groceries, medical supplies, and it's these fears. Anxieties become the new normal. And so it's really difficult with COVID in particular to be able to understand what people need to do. So it's really hard. It's because of all those factors.
I know this may be a hard question to ask in the short time that we have, but physiologically speaking, what happens to someone's brain when they start constituting or thinking about committing suicide?
It's their brain. With depression in general, what ends up happening is your brain doesn't function in the limbic system as well as it did before. So you're going to start to, see some of those changes in regard to gray matter and things like that, because you'll also have an increase in substance abuse and depression. So the brain changes as people are socially isolated. Social connectiveness is so important. And I think because of the social distancing and the quarantines that we've had, it's been really difficult. And I think people are pretty depressed out there and brains have changed.
And that's really tough, because what do you do if you can't reach somebody at this point?
It is tough. That's why, I think it's important to at least reach out to people that you think that could help. Call the hotline. Facebook, there's different types of people on Facebook doing mental health things. Mm-hmm. I know that one of the suicide prevention hotlines are going to do a virtual meeting. So it's doing those types of things and really trying to connect with people. And remember, you're not responsible for preventing someone from taking their own life, but your interventions and support may help other people see that they have options and that they can stay safe and get treatment. So treatment really is the option that we like people to do. I think the other people that can identify it is people like healthcare workers, or even the pharmacy people, or the grocery store folks that see people that they usually see, or people are not coming in. So those people in the community also can help identify.
And don't be afraid to say something if you see something, right, Linda?
Correct. That's exactly true.
Thank you very much, Linda Lewaniak. Appreciate it. We want to remind you out there that there is help. The National Suicide Prevention Lifeline is there 24 hours a day, 7 days a week. You can call the number on your screen, or you can text HOME, HOME, to 272-441.
Sometimes just the "Are you okay?" goes a long way.